City of San Francisco shuts down a $22 million open-air drug market after we referred less than 1% of the addicts who came to it for treatment, or just 18 addicts out of 23,000 it welcomed in its first 4 months. This was an open-air drug center where addicts could come in and safely shoot up, and we were told it's because then they wouldn't be robbed by other drug dealers, other drug addicts, and they could get the help that they needed. Now that they're in getting their clean needles and they're shooting up in a, safe environment, now they might be able to opt in for that treatment that they've been so looking for. Well, when you got just less than 1% of the folks that come in and use your facility looking for actual treatment, kind of tells you where things were. Now, reasonable people know that this was just a sham to begin with. This is just one of those San Francisco things. This is one of those, well, let's just hand out clean needles in the library, right? Yeah. It's like, no, I don't think that's a good idea. The whole harm reduction thing, that's just leading to more and more people dying of overdoses because you've got that whole fentanyl deal out there. So this open air drug center, this, clean shoot up site in the Tenderloin District of San Francisco, and from my understanding, it was pretty much just a free for all. I mean, and why wouldn't it be? The Tenderloin's kind of already in that direction, right? So the concept there was, well, harm prevention. If they're going to stick themselves with a needle, let's make sure it's clean so that when they overdose, at least they used a clean needle. Okay. All right. Yeah. What's the dealio? What's going on here? What's the bigger picture? Let's take a look. Let's jump on in. Let's find out what's going on in the Tenderloin District, San Francisco. San Francisco's open-air drug market in the Tenderloin District has closed less than a year after opening to the public. The site, opened by San Francisco Mayor London Breed, that's about all you need to know right there, right? London Breed, not a good mayor. Mayor London, but people of San Francisco, you voted that mayor in. You're stuck with London Breed. There you go. Good luck with that. All right, enjoy. The site opened by San Francisco Mayor London Breed earlier this year as a way to tackle the city's ongoing drug crisis. Just give them a safe place. It'll go away. They'll seek treatment. Oh, wait a minute. What'd we say? Less than 1% did? That means 99% and slightly greater just went there to take taxpayer handouts in the form of clean needles and whatever else they got there. Cost about $22 million to operate. Citizens of San Francisco, do you feel good that your taxpayer dollars are going to some fentanyl addict to shoot up, mostly in a clean manner and then come out and rob your home? If you're comfortable with that, I'd say, hey, keep going the direction you're going because you're there. The Tenderloin Center, an addiction services site, was often referred to as a safe place for addicts to get high without getting robbed. Boy, that is some marketing right there, isn't it? All right, you can shoot up here and odds are pretty high. You won't get jacked. Okay. Yeah. This is according to one person who used the center. In the first 4 months of the center's opening, the open-air drug market also referred just 18 people of the more than 23,000 it welcomed. So getting people into treatment, there is your poster child right there for why this doesn't work. Because people don't want to go into treatment. Okay, and this was referred 18 people to treatment. We don't know if they actually went. That's the stats. So even way less than 1% more than likely sought treatment physically and went there. Because we get these statistics all the time. Well, during clearing out this homeless encampment, we saw 14 people out of the 275 that were living there, they sought shelter. And that just means they considered it and they may have spent one night in that shelter. Why is it so low that people seek treatment? Why is it so low that people in homeless encampments seek shelter in city-sponsored environments? Because they kind of want to just keep using drugs. Yeah, there you go. So why wouldn't this center just be an absolute failure? Or I guess you can look at it from the standpoint, a lot of, 23,000 people shot up mostly safely, except for those that probably died of an OD later or elsewhere, or, Yeah, you got that whole concept thing, but no, let's not dig into the weeds. Let's not dive into the weeds on that. I mean, we don't need to go there, do we? Overall, less than 1% of visits ended in a completed linkage to behavioral health programs. Whatever that means. I would love to know the textbook definition of completed linkage, because it was put in quotes. That means it's got some significance. Somebody that's in that field, let me know what that means. City leaders, including Breed, now say the site was a temporary solution. It was never meant to be long-term. It was a temporary solution offered up as a way to avoid the more than 640 overdose deaths by San Francisco that they saw in 2021. Well, how many do we have in 2022? I bet you it's more than that. All right, then we got a nice picture of some woman lifting up her skirt and just shooting up into her upper thigh. Oh, it's brutal. She's in a wheelchair. Hardcore. Hey, I did a podcast. We're gonna still talk about drugs, but did a podcast a little bit ago about the rise in overdoses within the senior population. And you guys kind of let me know, hey, the angle that you're missing here, Sean, is seniors are having a tough time sometimes getting their drugs, and they're in incredible pain. And healthcare system combined with their doctor, they're either giving them too much or too little. They just can't get the situation right. And so many of you shared me your stories about how you had considered using fentanyl yourself. You were in such pain and you were just going to go on the street because you were like desperate. I get that there's a lot of situations out there where drug use is beyond what your doctor prescribes. But my thought is, okay, that is horrible. It's just the numbers in general of senior citizens that are being impacted. And so that's why I wanted to read that story. But apparently I didn't have the take that a lot of you wanted to see, which was, hey, the flip side to that is there's a lot of situations where good, honest, hardworking people, maybe a veteran coming back from the war, has been back for years and years and years, and they've got extensive pain. They've got situations that are debilitating, crippling pain, and they can't get help from their doctors, or they've been boxed out by their HMO, whatever it is. And so there's a lot of situations where people are turning to illegal drugs because they can't get it normally. And that is sometimes when you've got, a situation where somebody ODs, and it's not like they're in a tent, burning the tinfoil fentanyl. It's a wildly different approach. So I appreciate all the feedback on that storyline. And my deal is with you, the audience, is that I'm not going to know every storyline. I don't know every storyline. There are some storylines where I need to spend a couple of days reading about them to kind of get a handle on, what I think or what I grasp. My deal is sometimes I'm just going to read a story. And if my opinion is just, bass backwards, okay, then that's a starting point. And then we talk about it and we have a dialogue. We're reasonable. We have a discussion and we talk about, hey, Sean, you were wrong here. All right, probably. It's probably not the last time I'll be wrong. It's certainly not the first. But we have a discussion on what is reasonable. And so thank you all so much for your input on the senior citizens, the rise in overdose deaths, and why you feel and, your stories, how those kind of, impact a situation that is ongoing, because I have quite an older audience than most YouTubers. And thank you for everybody that's subscribed. And if you haven't subscribed, I'd love to have you as a subscriber. Hit that notification bell, all that normal stuff you're supposed to do. I'm supposed to say that a lot, but I don't because it's annoying. And I know it's annoying. And it's kind of like, all right. So if you do me a solid, just hit subscribe. Fair enough, right? Okay. Or don't. I'm always one of those guys. Don't tell me what to do. I'll do it when I'm good and ready. All right. Despite their efforts, 2022 has been nearly just as deadly as more than 500 people have died from overdoses throughout the California city. In 2021, there were 641. All right. So we still got a lot of overdoses, and the year isn't up yet, is it? Holidays coming. That's a tough time for folks on drugs because they're reminded, they're hit up every single day that they have left their families behind, that they're in a situation where it appears that nobody loves them. And why wouldn't you blow yourself up kablooey? That's, if you're hooked in that endless cycle of drugs, holidays are a brutal time. Just not good. Officials had also hoped the site would offer a place to deal with the homeless crisis the city has faced in recent months and years. Okay, offering a place for people to do drugs, that's not really going to help. I mean, in my humble opinion, right? Some estimates indicate that hundreds of people visited the Tenderloin Center while it was open, and more than 350 overdoses were reversed at the location. All right. Okay. So that would be your argument. But how many of those overdoses didn't need to take place in the beginning at all in general? How many of those could have been prevented by basically telling people and having consequences for drug possession, drug dealing, all this stuff that we've basically just legalized. We just made it okay. And then we're like, we prevented 350 overdoses. Yeah, but how many of those could have been prevented altogether? And how many people that overdosed that were saved will go on to overdose later and die? Yeah, a large percentage. I mean, those are the odds, right? Those are the odds. Workers were seen handing out pamphlets to those outside of the open-air drug market, referring them to other places where they can obtain vital resources. Breed and others have not announced plans for a similar site at this time. The closure, which debuted to mixed reactions, now has some thanking the mayor while others criticize her for taking away what they say is a critical resource. Others, however, described it as a massive waste of taxpayers' dollars. $22 million. That's crazy. But letting people run around, live in tents, shoot up, rob from God-fearing, hard-working citizens. Granted, and here's what I know you're going to say, those citizens are voting for the politicians that are enabling this kind of waste of taxpayers' dollars. And as long as that continues, San Francisco gets what it gets. But I guess from the rest of us, and I'm in Seattle, so I see the same thing. I'm like, all right, we're handing out clean needles at the library? That is not the Seattle that I know. But our politics in Seattle have just gone down this road that, we've got all this kind of stuff going on that is not uncommon to cities that lean heavily towards this type of policy. So $22 million, maybe it's lucky that they got out with only that amount of money being spent. But $22 million, 350 overdoses, saved. I don't think that's really a stat that you can point to and go, it was a rounding success. And then so few people were, pointed towards treatment or engaged in treatment. I mean, that's it. Yeah, it's nuts, right? This has been something we've been demanding from the mayor for months, said San Francisco City Supervisor Dean Preston in an interview with ABC7, who also said they have hundreds of people relying on it. City wants it. I mean, yeah. Dr. Hilary Kunins, the official with the San Francisco Department of Public Health, said the center closed for multiple reasons, including a $75,000 a month lease that was ending. So you've got all this stuff with the pandemic, all of, eviction moratoriums, programs that were put in place. Did one yesterday in New York City. They've got an elevated number of rats within the city. Rat population has exploded. And some think it's because of all the shacks that were built so you could have outside dining at restaurants. Now those shacks are dilapidated and they've got garbage all around them and the rat population is exploding. So you got a bunch of holdover stuff from the Rona that we're working our way through. San Francisco is working its way through. All right, you got to get rid of this open-air drug center. I've never thought these things were a good idea. It's totally enabling behavior. Yeah, we know you're going to do it, but you shouldn't be doing it in the first place because it's not good for you. It's literally killing you. But, in cities like San Francisco, they just take the approach of, whatever. I mean, people can do what they want to do. It doesn't really work. And it's not working. And it's not working here in Seattle. You can see it in all the homeless encampments. You can see it on the streets where it's an issue. I mean, it's crazy. Fentanyl. We've got, what did somebody say? It was the fentanyl fiesta, something along like that. A public official in Seattle called it that. And it's like, yeah, that's not good. And it's not just the fentanyl. It's not just whatever it is, meth. It's everything that comes with that info structure. It's all the robbery. It's the needles. It's the human feces everywhere. It's people living in just crazy situations. That's the stuff that comes along with it. And I think a lot of folks just don't want to deal with. But every city's kind of dealing with it on their own. San Francisco? Yeah. All right. That's it for me. Thanks so much for being here. We'll catch up in the next one. Bye for now.